Welcome to Wonder Hair Career Institute Online. My name is Levina and I will be your instructor for today. And today we are going to talk about feeding a resident who is sitting in a chair. We're going to look at the care plan. On your exam day, you will be given instructions on which skill you are going to do. If your skill, one of your skill is feeding, the instruction on that card will read like this. You are asked to feed a snack to a resident who is not able to feed him or herself. The resident is sitting in a chair in an inappropriate position for feeding. This is key point. Inappropriate position for feeding. A food and fluid intake form is provided to record the resident's estimated food and fluid intake. Of course, the role of the patient for this skill will be one of the students on that day. So we'll start again on the checklist number 3. Remember what the care plan says. This patient is sitting in an inappropriate position. So you start by assisting the resident to sit appropriately. Remember, inappropriate position, the person might be leaning on one side. Depending on how the NAE will tell the person to be on that day, you want to assist that patient to an upright position. Then you offer the resident something like damp washcloth, paper towel, or hand wipe to clean his or her hand. This one is on number 4. This is important points to note here. We have on number 5 says sit while feeding the resident. I don't know who will stand while feeding their resident. When you are feeding your baby at home, when you are eating even your own food, do you stand? And the answer is no. So you must sit while you are feeding your resident. Offer to protect resident clothing with a barrier before feeding, and if used, remove barrier at the end of the feeding. Clothing protector. Don't call clothing protector bib. Bib is for babies. So you don't want to address your patient like babies. Use spoon to feed your resident. Offer fluid to drink throughout feeding, at least every 2 to 3 bites of food. Critical. You want to make sure after 2 or 3 bites, you offer drink to your resident. Allow resident the opportunity to swallow before feeding the next bite. Converse with resident during meal. During meals, it's time the residents socialize with others. If you are feeding your resident, engage the resident with a little conversation. Please don't engage that kind of a conversation where the person will not be able to chew his or her food. Leave area around resident mouth clean and dry when care completed. When you finish feeding, please remember you have to clean your resident mouth. Whether there is food or on the mouth or not, please make sure you clean the resident mouth, or else you might not pass the skill or points deducted. Complete skill: placing any used linen in hamper, disposing of trash, and leaving over bed table dry. Record the amount of the resident food taken on the food and fluid intake form within 25% of the nurse's measurement. All right, so when you feeding your resident, there are critical things you need to pay attention to. 1, make sure you ask your resident to sit properly, or you assist the resident to sit upright or appropriately. 2, make sure you wipe your resident hands. You know why? Because they might put that hand inside their mouth. Because you are feeding them doesn't mean they cannot put their hand in their mouth. Another point you have to remember is this: when you finish, remember you are feeding your fellow student as your resident. You might not see food on that your student mouth, or let me say resident. But please, if you want to pass this skill, make sure you clean the mouth. Another point you have to remember is when you offer food, after 2 to 3 bites, make sure you offer fluid, something to drink. Another point you have to remember is make sure you dispose things where they're supposed to be. When you want to record, I have already said this in the previous videos, you cannot record anything on your phone without washing your hand. When you finish and you wash your hand, the paper you're going to record what your patient eats, what your patient drink is this form, intake and form. All right. Now, remember what we have on your instruction card. You will see feed a snack to your resident. Please pay attention. When you see this font, you will see meal, snack. If you check meal, you might fail this skill. Make sure you check snack, because what you're going to feed your patient is what? Snack. On the second row, it says check 1, amount of food eaten. You can only record 0, 25, 50, 75, or 100. So you have to check how many bites or spoons your patient eats. Remember, the food most times is applesauce or pudding. It is not graduated where you can say, oh, it's 50 or 60. So you have to estimate. On the amount of fluid intake taken, the same thing. It has to be either 0, 25, 50, 75, or 100%. Again, you have to estimate. But the good thing is, whatever you write as the amount of food or the drinks your patient consume, it has to be within 25% of the nurse's measurement. So that gives you opportunity also to pass this skill. So if you have 50% and your nurse evaluator have 25%, you get that part correct, because the measurement has to be within 25% of the nurse's what? Measurement. Look at some questions. Now, when you are feeding a resident who is lying in bed, the head of the bed is raised. Why? Why do you raise the head of the bed if you are feeding somebody who is in bed? To decrease risk of what? Aspiration. Even you that is taking this test, can you eat lying flat on bed? No. Have you think about why can't I eat when I'm lying down? You don't want to choke, right? Yes. To decrease the risk of what? Aspiration. While feeding a resident, the nurse aide noticed that the resident is coughing a lot after each drink of fluid. What is the appropriate response by the nurse aide? Stop feeding and ask a nurse to check the resident. Now, If you are feeding a resident and they start coughing, do you start abdominal thrust or do you stop feeding? I hope you will not choose abdominal thrust. There is difference between choking, somebody who is actively choking, and somebody who is coughing. If the person is coughing and assuming there is something in the throat, you ask that person to cough more so that the whatever that is stuck in the throat will be out. If the person is actively choking, that's when you do abdominal thrust. But in this case, you give your patient fluid and they start coughing. Something is wrong. Remember, there are these patients that drink thickened liquid. It is not fun. It is not because they want thickened liquid. There is reason why they are drinking those thickened liquid. So that's why you need to stop feeding and notify the nurse. These kind of people need to be evaluated by what? Speech therapists. At the evaluation, the person might be on taking liquid or maybe something else is going on. A resident is choking. The first response by the CNA should be, I said earlier, somebody is choking. Do you want to leave the person choking to go get the nurse? Remember, you are trained, you got a CPR certification. Choking is one of the things you do when you are doing your CPR. How to do abdominal thrust to relieve somebody who is choking. Remember the questions. When you are answering your questions, look for the keywords. Somebody is coughing and somebody is choking. They are two different things. If the person is choking, start abdominal thrust first. That's the first thing you need to do. Before feeding a resident, which of the following is the best reason to wash the resident hand? When I was going through the checklist says clean the resident hand with wipes or with a wet washcloth. The reason why you want to clean their hand is because they might put their hand in their mouth. The resident may touch their mouth or their food. So you don't want them to touch their food or their mouth with dirty hand. That's why you need to wash their hand, even if you're going to feed them. While watching the resident in the dining room, a nurse aide noticed that a resident is eating very little lunch. It is most important that the nurse aide do what? You have your resident. Whenever he comes to the dining room, he's eating very little. It's unusual. Do you record, 25%, Miss Jones is not eating. Lunch, 25%, she's not eating. Dinner, he didn't eat at all. And you think it's okay to leave the patient like that. Remember, the CNAs are the what? Eye, nose, and of what? The nurses. If you don't report this observation to the nurse might not notice that, or the nurse might not catch this problem on time. So there is reason why this person is not eating his food. So the first thing you will ask this patient is, do you want to eat something else? Maybe the food is not good. Maybe the patient don't like it. There are so many things you can offer this patient. But first of all, find out if the person like the food or not. Why is she not eating this food? Another question. A nurse aide is assisting a resident at mealtime. The resident grabs his note and cannot speak. What should the nurse aide do first? What is the universal choking sign when somebody is grabbing his or her throat? You call that person Miss Jones, and he's telling you like this. He cannot talk, she cannot talk. This person is actively choking. What will you do? Start abdominal thrust. All right? Start abdominal thrust. When feeding a resident, frequent coughing can be a sign that this person is having what? You might encounter all these things when you start walking. Somebody is coughing every time he's eating. What does that tell you? This person is having difficulty swallowing. That's why he or she needs to be evaluated by the what? Speech therapist. A resident is NPO because of nausea. What should the nurse aide do? What is NPO? Nothing by mouth. If this person is NPO, which means nothing by mouth, meaning the person cannot drink or eat anything by mouth. Now, what will you do if you see a water pitcher on the person's bedside? You remove it, right? Because the person might be tempted to drink that fluid, which could cause more harm. I hope you enjoy these little tips that I just gave you now. If you do, please subscribe and hit the notification button. Good luck in your exams. Thank you.